Hello, everyone. Welcome to our presentation. I am Dolores Bella, and
I'm Mark Ndeke.
our final presentation is over social determinants of health on dialysis outcomes among African Americans with end-stage renal disease.
And this is the abstract, is the summary about our topic, and we'll have more discussion as we get to the poster.
So, the impact of social determinants of health on dialysis outcomes for among African American patients with end-stage renal disease. Um, we we took this project on with some knowledge because I have personal and professional experience with having a loved one on dialysis, and also with working with people that do dialysis in my skilled nursing facility. And Mark, what capacity do you work with patients?
Yeah, I work with patients trying to receive kidney transplants, so I do kidney transplants.
Yeah, and what's funny about this is before we took on this assignment, we really didn't even know each other worked in that capacity. So it was pretty cool that we both came from a little bit of knowledge. But what we did right here is we took a deeper dive into social determinants on health outcomes for individuals, specifically African American patients with end-stage renal disease. So our first column, we're pretty much it's the overall issue and the epidemiology behind end-stage renal disease. And if you see SRD, that's what it stands for. So pretty much end-stage renal disease is the most severe stage of kidney failure, kidney disease. And when that happens, it requires ongoing dialysis or a kidney transplant for survival. So what's important here is that African American patients, they're disproportionately affected, not just because of end-stage renal disease, but also in their outcomes, once they're on dialysis. Um, Pretty much the national level of African Americans, nearly 3 times more likely to develop end-stage renal disease compared to white individuals. So pretty much there, when we look at Texas, the burden is even higher with their state ranking at the highest for end-stage renal disease prevalence. And locally in areas like Dallas County, we see higher hospitalizations and mortality rates, especially in the predominantly minority communities. So we're not only seeing end-stage renal disease linked to diabetes and hypertension, which are pretty much they're if they're not controlled, that's pretty much what it leads to. And those are pretty much higher diagnosis in the African American population. But the other major issues that we're seeing um, are socioeconomic disparities, lack of transportation, lack of proper food, lack of social support. So what that tells us is that end-stage renal disease isn't just a medical condition. It's a deeper systemic issue with access. Access is pretty important, and when you don't have access, the continuity of care just isn't there.
Yeah, thank you so much, Dolores. So to add on to that, basically, all these patients that go through dialysis, there are social determinants that affect their treatments. And like Dolores said, we do have disparities that affect their care. So some of the social determinants of health include access to insurance gaps. So when these patients don't have insurance, there's that gap that they can't get treatment. And what that leads to is high mortality rates and hospitalization rates. Also, transportation barriers as well. If they can't make it to dialysis or they miss their appointments, they tend to have poor outcomes at the end. So socioeconomic, financial instability, housing, medication, they can't afford their prescriptions as well. Their outcomes tend to be poor. And lastly, education and literacy. This is huge. Some of these patients actually end up some of them end up getting this chronic disease because of not knowing how to take care of themselves, whether to diabetes or hypertension.
Yeah.
So on the side of disparities, we've seen like patients with end-stage renal disease, especially the African Americans, tend to be high. Some of it's their geography or bias to health access. Also, some of the issues we saw during our research was they tend not to get care from the beginning. By the time they go to dialysis, it's late down, the downstream. So so some of the issues we need to look at, see how we can fix upstream so these patients can have access before actually they end up, in dialysis. The last point is that these patients also don't get transplant access like the general population. So for some reason, these bias issues also tend to limit them from getting access to transplants.
Yeah. Wow, that's a lot. So it's pretty much now that we understand that the problem isn't just medical, and we kind of understand what's driving it. So the next question pretty much is how do we address it? Um, so I think from like a population health perspective, uh, we focus on prevention, um, chronic disease management, better, diabetic management and hypertension management, and pretty much how care is delivered. I know healthcare literacy, it's a big deal, especially in the cultures. A lot of people aren't taking it serious because they're not really understanding. We're not speaking their language, if you will. So, using the four pillars on there, we focus on prevention, chronic disease management, transforming how we deliver care. So these strategies, they align with the triple aim, improving patient experience, improving population health outcomes, and pretty much reducing healthcare costs. And that's a big thing. Healthcare costs, these rehospitalizations, this costs in the hospitals a lot. Um, so some preventions that we could think of, better patient navigation with social workers whenever somebody's, diagnosed initially. Um, I know that a lot of people have issues getting to the doctor, to the nephrologist. Transportation is an issue. So coming up with like telehealth appointments, that way people can meet by phone instead of face to face when that's not available. Um, just more community screenings, collaborative community, um, events that we could, do. So those are just a couple of ideas, pretty much.
Yeah. So in conclusion to our research, we go back real quick.
Hmm. Oh, sorry. Mm-hmm.
You're good. Thank you. So in conclusion, all these factors and strategies, after doing the research, the only way we can accomplish this task is by having, all different the professionals, doctors, social work coordinators, everybody, the community workers work together to actually have a successful, kind of narrow down these disparities and create that access to healthcare for these communities.
Yeah. Yeah, absolutely. Well, y'all are seeing it all over again. I'm so sorry. Okay. So sorry about that, y'all. So right here is the list of our references. They were amazing peer reviews, a lot of amazing journals that we got to dive into. So very, very informative, and pretty much, it was just our guiding light through this journey of this final project. So we're going to get to the discussion prompt, and the discussion prompt is should healthcare systems invest more in social support services like transportation and care coordination, rather than the traditional clinical expansion to improve in-stage renal disease outcomes?
Yeah, thank you for a wonderful semester and getting to meet all of you in our discussions. Look forward to meeting you in the next classes. And here, these are our email contacts in case you have any questions. And this is where our link will be posted. Thank you
Yep.
so much.
Thank you, everybody.
Bye.